Dear viewers, ladies and gentlemen, it gives me great pleasure on behalf of the Supreme Committee to welcome you all to this press conference. A lot has happened since we met last time, and we've had many questions about the decisions taken by the Supreme Committee. And I will try to answer as many of them as possible, but before that, as usual, I start with numbers. Yesterday, we had 101 cases confirmed of COVID-19 in Oman. And this is great news. At the peak of this wave, we had over 2,250 cases in one day. Those who were admitted yesterday to all healthcare facilities in Oman, between the ICU and the general ward, 17 patients only. And we reached a stage previously where we had more than 200 admissions a day. The total numbers in our facilities in ICU, as of this morning, 68 patients, and in the general ward, 79 patients. ICU, we reached, that's intensive care units. At the peak of this wave, we had 538 patients. So as you could see, and as we say, alhamdulillah, the numbers are coming down fast and hopefully steadily. Those who recovered, the percentage is 96.5%. Those who passed away yesterday, the death number was 2 cases. Internationally, the number of cases recorded up till this morning, 214,892,955. And those who died because of COVID-19, and this is definitely an underestimate, 4,479,383. So yes, our numbers are much better, thanks to the effort. Firstly, thanks to the support of His Majesty, Sultan Haytham bin Tariq, and for his directive to the Supreme Committee. Thanks to all those working in healthcare facilities and all supportive groups, but also thanks to all of you for taking care of your health and following the instructions that kept you away from this virus or kept this virus away from you. The numbers are down, but the pandemic, unfortunately, is still here worldwide. Of last week, the number of cases in North America went up by 8% according to WHO statistics. And many countries, the numbers are still going up, unfortunately. So it's not over. And I don't think any country can get rid of this virus without the whole world working together. Solidarity with each other to get rid of the virus and hopefully get rid of this pandemic. Let me now move to the vaccine. The number of doses we booked for Oman, 8,591,740. What we received so far, 3,950,449, and the number administered up till yesterday, 3,563,171. We've reached almost 70% vaccination of the first dose for the whole country for those 12 years and over or older. And almost 32% received the second dose. We aim by the end of this month, or let me be more realistic, the middle of next month, that 100% of the targeted groups will receive the vaccine. And we intensified our efforts to vaccinate the expatriates who did not as yet, unfortunately, receive the vaccine. And here I have to thank all the major companies and the smaller companies who participated and took part in vaccinating their staff. And I urge the rest to do the same. You've heard the decision from the Supreme Committee that from next month, any person who did not receive the vaccine, whether 1 or 2 doses, and initially might be 1, but eventually it will have to be 2 doses, will not be allowed to go to the working places, shopping malls, restaurant, any gathering, any places that are public. If you are not vaccinated, you will not be allowed to go there unless you have a medical reason that you cannot take the vaccine. And for those who unfortunately still have doubts about the efficacy of vaccines, let me repeat what I said in Arabic about this very huge survey or study. They looked at 100 million persons who were vaccinated and compared them to 100 million who were not. The number of cases in those who received the vaccine over a period of time was 10,000 cases only, because the vaccines are not 100% protection. We know that. They vary between 75 to 95%. Those who were not vaccinated, from 100 million, 35 million. So 10,000, 35 million. Those who had symptoms, and we know some people have the virus, but they are asymptomatic. They don't have symptoms. But from those who are vaccinated, only 2,000 became symptomatic, while those who were not vaccinated, 21 million were vaccinated. What we care about more is admission to hospitals. From those who were vaccinated, only 995 individuals ended up requiring hospital care, while those who were not vaccinated, 1.7 million ended up in hospitals. Let me give you the last figure. If you still have doubts about how important to be vaccinated, death from the 100 million persons who were vaccinated was only 160 individuals. Those who were not vaccinated, 181,000 died because of COVID-19. So it's very clear the efficacy of these vaccines, and as yet the safety of these vaccines. There are about 5 billion doses administered worldwide, and there are not any alarming reports of significant or serious side effects. So let me again just remind you that vaccines are one only of the tools that will help us to get rid of this virus. Vaccines alone are not enough. And I've mentioned that you could be 100%, you could have that 2 doses, i.e. vaccinated, but still you could acquire the virus, and unfortunately you could pass the virus to others. Therefore, wearing the mask properly and appropriately where needs to be, i.e. in any places that are gathering outside your own family, is a must. Keeping your physical or social distance, and preferably physical, is also a must. Hand hygiene, whether using sanitizers or washing with soap and water, is a must. We cannot rely on vaccines alone as yet. Particularly, there are millions or hundreds of millions worldwide who were not vaccinated. You might have a question about a booster or a 3rd dose of the vaccine. As yet, there are no scientific proofs that it is needed, and also we don't know whether, if there's any potential side effect, it will be worse with 3 doses. The recommendation of the CDC, Center of Disease Control in the United States of America, says they only recommendation for those who have diseases that reduce their immunities. And in every community we have those. But also, if we look from moral point of view, how can we justify giving people 3rd dose when countries around the world, they have not vaccinated their healthcare staff yet? They have not vaccinated their elderlies and people with chronic diseases, which make them at high risk of dying from this disease. Of course, this question and this moral issue depends on each country. But there might come a time when a booster is needed, yes, but is it now? As yet, we don't have the evidence, or actually the supply worldwide. So third dose is not as yet recommended, apart from very small percentage of the population. The last decision of the Supreme Committee regarding people who are abroad and want to come back to Oman, they are more than welcome. But the requirement for those who are coming as visitors, they must have received 2 doses of the vaccines which are registered in Oman, not necessarily used, but registered. And I'm going to read a list of these vaccines for your information. Pfizer, BioNTech, Oxford AstraZeneca, Covishield AstraZeneca, Sputnik V, Sinovac, CoronaVac, Moderna, Johnson, and Sinopharm. The 2 vaccines widely used in Oman, Pfizer is number 1, definitely more than 90%, followed by AstraZeneca. Therefore, any person who's coming for a visit must have the certificate with QR code that they are vaccinated. They will require a PCR test either at the country of origin or when they arrive to any of our airports, and we reserve the right to take at least 10% samples from any flights to check for coronavirus. For those who are having residency visa in Oman or working in Oman, and they are either on holiday or they went back to their countries, there are several categories. Some of them, they received the first dose in Oman, and unfortunately, Pfizer or AstraZeneca is not available in their countries. So those individuals, they can come back, but of course, they will require all the procedures that we've mentioned before. PCR before 72 hours, at least, or up to 96 hours before coming to Oman, PCR on arrival, quarantine for 7 days, on the 8th day, PCR, if that's negative, they can leave the quarantine, but they must also seek to get the second dose. And of course, there will be individuals who didn't receive any doses whatsoever, and if the need for them in Oman is a must, of course, following the same procedure, they will be allowed in. Going back to working places, it will be 100% capacity from the 1st of September, but of course the vaccine is a must again. Initially, we may be lenient and allow people who received 1 dose only, but toward the end of October or the middle of October, there should be no reason for any individual not to have had 2 doses of any of 1 or 2 of the vaccines which are available in Oman. And if there are cases that are not, they will be looked at individually. There were questions in Arabic. How are we going to monitor this, going to restaurants, to cinemas, to shopping malls, working places? I think the best monitor, of course, is ourselves. And we do trust here, because you know these decisions are not taken as punishment. These decisions are taken by the Supreme Committee after studying the recommendation of the technical teams to protect you, to protect the society. But of course, the responsibility of the organization, whether it's government or private, to make sure that the customers are vaccinated. If they need help, yes, the government, represented by Royal Oman Police, will be more than happy to support them. But we rely on the organizations after, of course, relying on the individuals to make sure that they are vaccinated. There were questions about that the decisions were not very clear sometimes from the Supreme Committee. I looked at some of the English translation. This is not criticism of my colleagues, they are much better than me in translation, but sometimes, unfortunately, translating technical issues from Arabic to English might not be that perfect. So I urge anybody who has got any queries about any of the decision to go to the concerned department, concerned ministry. If it's to do with healthcare, the Ministry of Health, regarding education, Her Excellency gave a press statement in Arabic, and I'm sure it will be available on their website for non-Arabic speaking schools and students, and the communication between the ministry and the international and private schools. I'm sure it is at its level best. But we are definitely more than happy to answer your queries, your questions, but we urge you at the same time, please do not think it's over. We all wish it's over. But how could it be over when still hundreds of thousands daily worldwide acquire the disease? Tens of thousands die daily. How could it be over when countries, as I said, still have not vaccinated 5 or even 10% of their population? How could it be over when hospitals in some countries didn't even have the basic oxygen to support lives of patients who required oxygen? It is not. And we all know the disparity, unfortunately, and the inequity of healthcare services worldwide. But each country, I'm sure, they do their level best to look after their own citizens first. Citizens, I mean everybody in their countries. But I think also the moral responsibility, as I said, we should work together, we should help each other as a community. Thank you very much for listening.